From the Kyle Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and it is time to check in with a good friend of ours, Dr. Josiah Fitzsimmons at Vero Neuropathy. And the question is, do you have chronic pain? You haven't been able to get rid of this chronic pain, and people have told you you just have to live with it. Well, we're going to talk to Dr. J here, and he says, no, that is not the case. Is that correct, Dr. J?
Absolutely.
Yeah, now Dr. Josiah Fitzsimmons is at Vero Neuropathy right here in Des Moines. He is board certified in neuropathy. Chronic pain can be very debilitating. We all know that. If you have it, you know exactly what we're talking about. But we've talked about this before. Let's talk about chronic pain and whether or not chronic pain could, in fact, be neuropathy.
Absolutely. Great question. Chronic pain could be the result of several conditions, one of which absolutely could be neuropathy. And you just talked about, Lou, it can be so debilitating. You know, if someone has burning pain, tingling sensations, muscle weakness or sensitivity, electric light pain or numbness, especially in the legs, feet or hands, it most definitely could be neuropathy. Typically the symptoms start out slowly and they increase over time as the nerve damage gets worse. But like you said, they just don't have to live with it.
Yeah, what should somebody do if they have this chronic pain and they want to relieve this pain?
Absolutely. So the best course of action is to see a professional for a complete evaluation and diagnosis. We have 8 doctors here all under one roof that specialize in neurologically based care and treating neuropathy. I mean, we have people come 5-6 hours one way. We use 8 different unique tests to calculate down the exact percentage of how much loss someone has in their hands or their feet.
Now, how would our viewers know if the treatments that you have will work for them specifically?
So like I was saying, what we do is we actually test 8 different unique tests on each individual's hands, feet, wherever they have sensory loss. We'll calculate down to the exact percentage of how much loss they have going on, and then we'll develop a custom treatment plan for the patients. All of our doctors will get together. We don't use any drugs, no injections. In fact, we have the most advanced non-surgical, FDA-cleared treatment protocol to actually regenerate the nerves, restore the arteries, and actually reverse neuropathy.
Now, there are a lot of questions that surround this and a lot of things that people need to realize. And we just learned that you have some seminars that are available around the area, too, at some really cool places. Why don't you tell us a little bit about that and what these seminars entail?
Absolutely. So they're educational seminars. Most times people with neuropathy or diabetic neuropathy just don't even know they have it. Or if they do know they have it, they have been told there's nothing you can do about it. And that's just not the case anymore with advancements in technology. And so what the seminars are is they're an opportunity for us to tell you a little bit more about what you have going on, a little bit more about neuropathy, help you understand if you have it. If you do, then we want to answer your questions. We provide free lunch or dinner. It's super easy for you to just come, attend one, find one that's close to you. We do them all over the metro.
Yeah, and some really great restaurants, too. We might want to add that, too. But if somebody is suffering from a diabetic nerve pain or neuropathy, as we've been talking about here, how soon can they be seen? Because we talked, you have a bunch of doctors there.
Yeah, so we have 8 doctors, like you said. So typically we can get people in within 48 hours. You really just give us a call. There's no reason to keep living in pain. And like I said, with neuropathy, it's a progressive degenerative condition. It's only going to get worse. It's so imperative to get on it sooner rather than later, so you have the best chance to get the full amount of correction.
Yeah, there's no reason to live in pain. And there is the number to call, 335-VERO, 335-VERO, and you can make an appointment there. And you are offering this absolutely no cost, right? This is free, and the dinner's free.
Yeah, exactly. Free seminar, free lunch, free dinner. Really, we just want to provide answers, opportunities, education. We want people to be informed. They've been told they can't be helped. That's not true. We want to educate people, answer questions, and then give people an opportunity, to make a decision that's best for their health from there.
And we understand it's really been an eye-opening experience, too, when people have a chance to sit down and learn about the particulars of what their pain could be coming from, the cause of it, the source of the pain, and then eye-opening, as we said, for people to realize they can come to Vero and be fixed, right?
Correct. I mean, we've had people that have been suffering with neuropathy for over 20 years, haven't felt their feet, in a decade, and they've gotten complete reversal. People that have been walkers or wheelchairs that are walking normally again. So most people just have no idea that we can help them, and they've just resigned to live in continual pain, but that's just not necessarily the case. They don't have to do that.
Now, all right, 335-VERO, 515 area code, of course, 515-335-VERO, V-E-R-O. See one of the seminars, experience one of the seminars, get your questions answered, and more importantly, get rid of your pain. Dr. J, thank you so much. We appreciate your time.
Thank you for having me, Lou.
All right, you're very welcome.